Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common, trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to discuss the use of Rituxan-Ifosfamide, carboplatin, and etoposide chemotherapy, otherwise known as RICE chemotherapy. To understand your treatment better, it's going to be necessary to have a brief refresher course on biology. Don't worry, we're going to keep it simple. Remember, all living things are made of cells, and the blueprint for how a cell and our bodies are made is encoded in a molecule called deoxyribonucleic acid, or DNA. Here's a brief video showing this process. So cancerous cells are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. And the cell cycle goes from a resting phase through active growing phases and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells since the cancer cells divide faster and don't have time to repair themselves prior to cell division. Let's show a brief video now on the cell cycle. So the scheduling of chemotherapy, therefore, is based on several factors: the type of cancer, the rate at which the cancer divides, and the time at which a given chemotherapy drug is likely to be effective within the cell cycle. And that is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During that time interval, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for some of the common side effects of chemotherapy, including low blood counts, mouth sores, nausea, and hair loss. Rituxan or rituximab is actually a monoclonal antibody, and it's designed to target or inactivate a specific protein on lymphoma cells, which is called CD20. Rituxan locks onto that target, CD20, and inactivates the protein, thereby promoting death of the lymphoma cell. Rituxan also helps your immune system recognize the cancer cell as foreign and attack it. Here's a brief video showing the CD20 molecule on the surface of the cell, and it's sending its signal to the cell nucleus to divide. Rituxan once again blocks this protein. Ifosfamide chemotherapy. Ifosfamide is an alkylating agent that works by cross-linking DNA and not allowing it to duplicate. If the cancer cell cannot duplicate its DNA, it dies. Normal cells have higher amounts of an enzyme that renders the drug inactive and are therefore less affected by the drug and are able to repair any DNA damage done. Carboplatin is a drug you'll be receiving, and it's an alkylating agent. It binds to DNA in the cancer cell during the resting phase of the cell cycle. Normal cells can repair the damage to the DNA, but cancer cells divide too quickly and attempt to replicate prior to repairing the DNA, resulting in cell death. How etoposide works. Etoposide forms a three-way or ternary complex with DNA and an enzyme called topoisomerase II, which is responsible for helping DNA unwind prior to replication. By inhibiting this enzyme, DNA replication is blocked and the cancer cell cannot divide and ultimately dies. Now let's discuss the schedule of RICE chemotherapy. All drugs are given by vein, that is to say intravenously or IV, 3 days consecutively every 21 days. The total number of treatments varies based on the extent of disease and response to treatment. An additional drug called Mesna is given to help protect the bladder. Anti-nausea medications are given prior to administration of RICE by vein and by mouth afterwards. The RICE regimen takes about 6 to 8 hours to administer on the first day, since the Rituxan is given slowly. On subsequent days, the treatment is usually shorter. Growth factors such as Neupogen or Neulasta may be given under the skin subcutaneously to help your white cells recover more quickly. Here we see a graphical representation of the RICE chemotherapy schedule. As we mentioned, on day 0, all drugs are given, Rituxan and the ICE chemotherapy. On the first and second day, ifosfamide and etoposide are given. Thereafter, Neulasta or Neupogen may be given to help the white cells recover more quickly. This cycle is repeated every 21 days. Now let's review infusion reactions which can occur with RICE chemotherapy. Infusion reactions are relatively common with the first dose of Rituxan but decrease in frequency with subsequent treatments. The reaction can include flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are quite mild, but very rarely can be serious or life-threatening. For this reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced by drugs such as antihistamines, which will be administered. Now let's review some side effects that can occur with the RICE chemotherapy regimen. Most importantly, remember that each person's reaction to chemotherapy is different. Some people have very few side effects while others experience more. The side effects described here will not happen to everyone who has RICE chemotherapy. Heartburn, for example, can occur. This often feels like a pit in the stomach or even nausea and can be treated with medications. Constipation or diarrhea can occur.
Constipation is more likely and can be treated with medications such as Miralax as well as foods that promote bowel movements. Muscle pain or headaches can occur with Neulasta. These can usually be treated with pain medications over the counter. Bladder irritation can occur with ifosfamide, but the drug Mesna is given with this ifosfamide to help reduce this possibility. Good fluid intake after chemotherapy should also help avoid this. Hair loss will occur 2 to 3 weeks after initiation of this regimen. Loss of hair on the head occurs first, but eyebrows, eyelashes, or pubic hair can be lost as treatment proceeds. Your hair will grow back at a normal rate after treatment, but may at first have a different color or texture. The cost of your wig may also be covered by insurance. Mouth sores as well as nasal tenderness can occur and can be minimized with mouth rinses or non-alcoholic mouthwashes. Blood counts, as we mentioned, especially your white cells, are reduced with this regimen. This occurs 5 to 7 days after the treatment's given. You should report any fever greater than 100.5 or a shaking chill to your healthcare team. You'll be given shots in all likelihood to help promote recovery of your immune system. Nausea can occur with this regimen and occurs about 6 to 48 hours after treatment. You'll be given anti-nausea medications before your treatment by vein and by mouth as needed thereafter. Lastly, RICE chemotherapy can affect fertility. Talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. As we mentioned, you're going to be receiving intravenous anti-nausea medications prior to your chemotherapy. In addition, we're going to provide you with prescriptions for medications you can take by mouth to combat nausea after your treatment. If you experience nausea when you get home, take these medications immediately. Don't hope or wish for it to just simply pass on its own. Since these medications can cause constipation, you may need Miralax or another mild laxative. Some of the medications we may provide for you include Zofran or ondansetron. You should take one 8 mg tablet every 8 hours as needed for nausea. This medication doesn't cause sleepiness, so it can be a good medication to take during the day when you want to be alert. Phenergan or promethazine is taken 1 tablet every 6 hours as needed for nausea. This medication can cause variable amounts of nausea, so please be aware of this. Ativan or lorazepam is taken once every 6 hours and almost always causes sleepiness. For that reason, you may want to take it at night to help you sleep. Now let's review frequently asked questions with regard to RICE chemotherapy. Can I drive to my chemotherapy treatments? We like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver for subsequent treatments. Will I gain weight with steroids such as prednisone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of the food you're eating. For example, avoid excessive desserts or salt. Can I get manicures, pedicures, or massage? Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures and pedicures, but you'll want to bring your own tools and avoid cutting cuticles. Avoid skin scrubs if you have skin sensitivity on the palms or soles of your feet. Massage is usually very helpful during treatment, but avoid deep muscle massage if your platelets are low. Are there any food restrictions? Avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements can also be a healthy, attractive food choice. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly with any dietary changes and focus on healthy, non-processed foods. That's always a good start. Should I take anti-nausea medications at home after my treatment? Well, this is often necessary or recommended as we've discussed, and therefore we'll discuss this with you even more during your visits with us. Can I take my regular medications? Absolutely. Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements and vitamins and chemotherapy drugs. Please assemble therefore a list of all the vitamins and supplements you're taking. In general, we really prefer that these be stopped until after your chemotherapy is complete to avoid any unanticipated side effects or drug interactions. These can usually be resumed after therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, there are times when ports are required due to poor or limited venous access, continuous infusions of drugs, or when the drugs are irritating to the veins. We're going to show a brief video at the end of all of this video to provide a summary for ports for chemotherapy administration. So in summary, RICE chemotherapy is effective medicine because there is a therapeutic window. In other words, the drugs are specifically designed to be toxic to cancer cells while your normal cells have the ability to recover from the treatment. The chemotherapy treatment and supportive medications, such as anti-nausea drugs and shots to help your immune system, are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. Lastly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That is what we're here for.
Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than half an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.